In America, there's a growing sense of frustration and powerlessness when it comes to healthcare. Men, women, and children alike are increasingly finding themselves at the mercy of a system that seems designed to limit their control over their own health. Skyrocketing medical costs, the inaccessibility of doctors, and the lack of patient autonomy in making healthcare decisions are all contributing to a dangerous crisis. The reality is that most of us, even in one of the wealthiest nations in the world, have little say in how we care for our bodies. The cost of healthcare, a barrier to access. One of the most pressing issues is the astronomical cost of medical care. It's a fact that has long dominated conversations about healthcare reform. Americans pay more for medical services and medications than almost any other developed country. A visit to the doctor's office can set a person back hundreds of dollars, even for those with insurance. The costs of more specialized care, surgeries or prescription drugs often become insurmountable, forcing people to make impossible decisions. For many, this means skipping appointments, foregoing necessary treatments, or rationing medications to stretch them out. People find themselves choosing between paying for medical care or meeting basic needs like food and housing. The result? Untreated conditions worsen, chronic illnesses progress unchecked, and preventable health issues turn into life-threatening emergencies. This financial burden does more than strain bank accounts, it strips people of their ability to seek care when they need it most. When access to healthcare is a privilege tied to one's income, the very notion of personal health autonomy disappears. The weight, when timely care is out of reach beyond the cost, there's another barrier that stands between Americans and their ability to manage their health, the unavailability of timely care. Even those who are able to afford healthcare often find themselves stuck in an endless waiting game. Appointments with specialists or primary care doctors can take weeks or even months to schedule. In that time, health conditions can deteriorate, and the anxiety of waiting only compounds the physical and emotional toll on patients. It's not uncommon for people to wait months to see a specialist, only to be granted a rushed 15-minute consultation that leaves more questions than answers. This lack of availability disproportionately affects those who are already most vulnerable, low-income families, those living in rural areas, and marginalized communities. The delay in care often leads to more serious health conditions, pushing patients into emergency rooms, where costs are even higher and care is reactive rather than preventive. The doctor knows best. The struggle for patient autonomy. Even when patients manage to overcome the hurdles of cost and access, another issue looms large: the lack of control over their own treatment decisions. Many patients feel that their voices are not heard when it comes to their care. Doctors, often overburdened with high patient volumes and limited time, may not spend enough time truly understanding a patient's concerns or individual experiences with their condition. In these rushed encounters, medical professionals can end up dictating care plans based on limited information. But here's the problem: patients often know their bodies and their responses to treatments better than anyone else. They live with their symptoms every day, understanding what works, what doesn't, and what side effects they can and cannot tolerate. Yet, too often, patients are not empowered to make decisions about their treatment. Whether it's because of rigid hospital protocols, insurance coverage restrictions, or doctors simply dismissing patients' input, the lack of agency is a common complaint. This dynamic leaves patients feeling unheard and undervalued, alienated from their own care. For example, a patient might be prescribed a medication that they know doesn't work for them, or has intolerable side effects, but are told by their doctor that it's the only option available under their insurance. Others may find themselves denied treatments that they believe would help them, simply because those treatments are too expensive or not approved by their healthcare provider. In a just healthcare system, patients would be active participants in their care. They would have the right to make informed decisions about their treatment, based on a collaboration with their doctor. However, in the current American healthcare landscape, patients are often sidelined in the very process that should be about them. The impact on children and families. Children are not exempt from these issues. Parents are often left fighting tooth and nail to secure the care their children need, only to face barriers at every turn. Whether it's long waiting lists for specialists, insurance denials for necessary treatments, or the sheer cost of medications, the stress and frustration for families can be overwhelming. For families with children who have chronic or life-threatening conditions, these obstacles can be devastating. Parents know their children best. They understand the unique challenges their kids face every day, and yet, they are often forced into a system where their voices are ignored, and decisions are made based on bureaucratic protocols rather than the well-being of the child. A healthcare system in need of reform. The American healthcare system, in its current state, strips people of their ability to take control of their health. The combination of high costs, long waits, and lack of patient empowerment has created a dangerous situation where people are denied the care they need, when they need it most. What's most tragic is that the system puts people in a position where they are unable to make decisions about their own bodies. The very autonomy that should be at the core of healthcare, allowing individuals to choose what's best for them, is routinely denied. It's time for a system that prioritizes the patient, that empowers people to make informed decisions in collaboration with healthcare professionals, and that removes financial and bureaucratic barriers to care. In a world where we are constantly told to take responsibility for our own health, we need a healthcare system that actually allows us to do so. Until then, millions of Americans will continue to navigate a broken system that keeps them from controlling their own health, often with devastating consequences. Conclusion: taking back control, the right to make decisions about one's health, should not be a luxury, it should be a fundamental aspect of any healthcare system. Yet, in America, many of us are forced to watch as that right slips through our fingers. The cost, the unavailability, and the lack of respect for patient autonomy are all symptoms of a system in desperate need of reform. It's time to take back control. We must advocate for a healthcare system that listens to patients, provides timely access to care, and respects the unique knowledge each person has about their own body. Only then can we truly begin to fix a system that has left so many feeling powerless in the face of their own health struggles.